Hi, this is the second video on shoulder pain. In this video, we will discuss the history and physical that you can expect the physician to perform. The physician will want to obtain a thorough history. The primary objective is to determine if the pain is caused by a problem in the neck or cervical spine, or if the pain arrives from the shoulder joint. The physician will want to know if the pain keeps you up at night. Do you have difficulty combing your hair? Does reaching around to your back cause pain? Does reaching over your shoulder to touch your shoulder blade cause pain? Is the pain worse when walking? What else makes the pain worse? Is your neck stiff? Is the pain worse in the morning? Do you have pain or stiffness in both shoulders? Does the pain present with increased activities such as household work, sports, exercise, or other daily activities? Have you had a recent injury before the pain started? Once the history is completed, the physician will begin the physical exam. The cervical spine, the spine supporting the head and neck, and the shoulder joint will be examined. Physical examination of the neck and cervical spine will not be discussed in this video. A series of videos specifically addresses neck pain. The physician will inspect, palpate, and move the shoulder joints. The shoulder joints will be inspected for their shape and contour. Each side will be compared to the other. Attention will also be directed to the location of the scapula, also called the shoulder blade. This bone connects the humerus or the upper arm bone with the clavicle or collarbone. Inspection will also be directed to any muscle wasting or deformity. Palpation will consist of the physician palpating the structure of the shoulder joint, the acromioclavicular joint, the subacromial space, the infraspinatus tendon, and the supraspinatus tendon, and the biceps tendon. Movements of the shoulder joint will give the physician further information to allow he or she to define a diagnosis. The physician will test each side and take the movements through their full range of motion in order to elicit pain or any deficits that should be noted. The physician will, with the patient's palms facing inward toward the body, move the arm upwards to a position above the head and then return the arm to its starting position. If the movement is limited, this points to the fact that the bursa may be inflamed and swollen with more fluid causing pain. It may also indicate an impingement problem. When you raise your arm to shoulder height, the space between the acromion and the rotator cuff narrows. The acromion can rub against or impinge the tendon and the bursa, causing irritation and pain. Now the physician will then move the arm outward and upward. This is called abduction. He will move the arm outward and upward as far as it can go without causing pain. This movement is helpful in diagnosing supraspinatus tendinitis. If the pain occurs during the middle of the abduction or outward movement, it points to the physician to consider supraspinatus tendinitis, infraspinatus tendinitis, or a subacromial bursitis. The physician will then ask the patient to place his or her arms by their side, with the elbow flexed to 90 degrees, with the palms facing inward toward the body. The physician will then move the forearm outward to test external rotation of the shoulder joint, and then inward toward the body to test internal rotation. The infraspinatus and biceps are involved in external rotation. The subscapularis and teres minor are involved with internal rotation. The physician will then test movement against resistance. To test the supraspinatus, the physician will ask the patient to hold the arm slightly outward from the body and push the arm further outward. At the same time, the physician will hold the patient's arm and resist this movement. Pain will indicate a supraspinatus problem. Another test for the supraspinatus is to have the patient place the arms outstretched and forward from the body at shoulder level. The patient's hands must be rotated inward, so the palms are facing outward and the thumbs point toward the floor. The patient is instructed to push the arms upward while the physician pushes downward against the movement. If pain is produced, the test is positive for rotator cuff problems, particularly the supraspinatus. Testing the subscapularis can be done by having the patient stand with both arms by his or her side, and the arm should be flexed forward to 90 degrees at the elbow. The patient will be instructed to move the arms sideways toward the midline of the body, while the physician is holding the patient's wrists and resisting the movement. Pain would indicate a subscapularis problem. To test the infraspinatus, the patient will be standing in the same position as for the subscapularis test. The patient will be instructed to move the forearms outward while the physician resists the movement. Pain indicates a possible infraspinatus problem. To test the biceps, the physician will have the patient raise the straightened arm forward and upward against resistance. Pain in the area of the bicipital groove points to a biceps problem. The video is running longer than I wanted, so we will continue our discussion on the next video. I hope this helps. Have a good day.